On One with Lady Peace, and today we have a special guest in our program who is a naturopath doctor named Dr. Martins Enyinju Oluwa. You are welcome, ma.
Thank you. Nice to be here.
Thank you, ma. And today we are going to talk on a very sensitive topic, infertility, and I want to know our point of view as a naturopath doctor. Let's begin with the basics, ma. From a naturopathic point of view, what exactly is infertility?
Infertility is a broad and interesting question, especially when it comes to our society nowadays. Because of the pressure, yes, I'll put that, because of the pressure on individuals, infertility is just the inability to conceive after 1 year of unprotected sex. So you can start to consider that a person has this issue after 12 months of consistent sex that is unprotected, and yet there is no conception. So you can say, yes, the person has fertility problem.
Okay, that's when the person have unprotected sex for 12 months straight.
Yes.
Okay, and what are some of the common causes you have observed in both in male and female?
Okay, that is a very tricky and yet interesting one. In men, the causes of infertility is mostly stress, environmental stress, occupational stress, the stress on I have to be at certain places tomorrow. And the thing about sex for men is that sex comes from their head. When their head is not calm, when they're not relaxed, that result will not show. So for men, stress is a major factor. And believe it or not, men actually have what we call hormonal imbalance as well. Yes, hormonal imbalance is what will cause a man's sperm to drop. You understand? And coupled with stress and hormonal imbalance, yes, will make a man's sperm, will make a man to be infertile. And for women, hormonal imbalance, like I mentioned in the man, is still vice versa for both. And then we have environmental factors for women. We have endometritis, we have PCOS. All these things I just mentioned can cause fibroid. Blockage of fallopian tube can cause it in a woman, whereby, the sperm, it swims actually. So if he is not the gatekeeper, someone is blocking the way. And so these are the things that causes a woman to be infertile. And from a naturopath point of view, we don't know these things except we run tests, you understand? So because we are natural medicine, doesn't mean we don't do tests. We work with tests, we work with history of individuals to be able to know that, yes, this is what is causing their own before we know exactly what to recommend for them.
And why do you think infertility has become such a growing concern in recent times?
Oh, that's a good question. The reason why infertility has grown over the years is because we've paid less attention to ourselves. If you observe, if you have a natural store where you sell natural juice, you come here and you get your blended pineapple, you get your blended banana, and there's another person selling, let me not mention brand, selling carbonated drinks. That person will sell faster than you. It's only the so-called rich men that are going to stop by at your place. And so this is a concern because we don't pay attention to what we eat, neglecting the fact that it is what we eat that affect our overall body. A person is the embodiment of what you daily put into your mouth. That is why they will advise that you should make your food your medicine so that you don't use medicine as food. Understand? So
Thank you very much. Many people immediately think of conventional medical treatments when they hear infertility. How is the naturopathic approach different?
That the naturopathic approach is very much, not because I'm in that line, but very much interesting for me, because we don't just look at the causes. We don't do, we actually deal with the root cause rather than get this over with and, you know, get your results and have your baby. In natural medicine, we make sure that the underlying cause is dealt with. That is why we, after running series of tests, we know what aligns with your body, because it's not everything that is synergic to individual body. So we check what works for you and with you, with your system, and then we now try to tackle the root cause. In a woman looking forward to having a baby, our major concern is not her having that baby, is to take out what is causing her not to have it. So whereby in the nearest future, that thing does not repeat itself. That's why most of the time when a naturopath treats you, or you get your treatment from any natural medicine person that knows what they are doing, you see that that particular thing you treat yourself for does not reoccur. That is one thing with us. We do not do reoccurring, we don't usually have reoccurring problem once we treat that thing, because we deal with the underlying cause of it. If it's hormonal imbalance, we deal with it. If it's fibroid, we deal with it in the right way that is best for individual. Yes, I will mention that is right, because there are certain treatments that are not right for everybody in general, and that is why you need a doctor in your life. The doctor that I mean here is natural doctor. We're there not just to tell you what to do, but to tell you when to do it, when to pause, and when to continue with another thing.
That's very brilliant. Can you explain how natural medicine helps to restore fertility? For example, through detoxification, hormonal balance, nutrition, or stress management?
Okay. Okay, let me start from that stress management. Like I mentioned earlier, that in men, stress is a major factor because it causes their sperm to be watered down. Yes, that's the English to use for it. It causes their sperm to be watered down due to the heat. You know, there's a particular pH the body is supposed to maintain. So the same with women as well. We have a lot of working class, and the society has put a lot of pressure on women now that you have to meet certain standard. If not, if you tell anyone you're an housewife, you're like a lazy person. So yeah, that's stress, that, and the society expects more from women than men when it comes to giving in office spaces. And so this pressure most of the time make a woman to be turned off, you know. Like I think I mentioned it then, that a man, sex or intercourse comes from the mind, right? But for a woman, it comes from the heart. A man can get a woman pregnant, that's A, but is not able to impregnate B. It's the same man, his sperm count is fine, everything with the man is fine, but it has to do with with the woman mental readiness, you know. That is why we counsel, we educate, we tell you that this thing you're going through is not the end of the world. When you give a woman assurance, the same way men win a woman by sweet words, you gain a woman, or you get a woman to our hormone, our general being, to open up to life, because a woman is an incubator. So when she doesn't trust that this thing can survive in her body because the person giving it to her is not to be trusted, it will affect her. So that is the stress. You have to make a woman mentally ready, and emotionally, that is the first and best, emotionally ready, you know, that you can do this. Some women don't even know that they're having that issue, you know, that I'm the one that is not ready. And a woman body, that's another thing to mention, that when it comes to gender selection, it's the woman body that chooses. The man body dispenses, but the woman body chooses that I want a girl, I want a boy.
Interesting.
Yes, it is psychological. And so for a woman, she needs to be emotionally ready. Once there is no issue of high prolactin, high, you know, PCOS, endometritis, once all these things are cancelled out and a woman is not yet able to conceive still, deal with that emotionally, and then you'll see results.
So, wow. So, what you are saying is you start with counseling.
Yes, we counsel.
Counsel.
Yes, make sure they are ready. Some people don't know that they're not ready. Yes, we ask them certain questions, let them open up to you. Some, it could be their fear. Some could say, I'm ready. And at the back of their mind, they're thinking, if I'm pregnant, won't it affect my work? That but mentally cuts it off. So make a woman know that she's ready. Let her be aware. So that's why go through counseling and then address some other health issue that the woman might be having.
Okay, thank you. Are there specific herbs, therapies, or lifestyle changes that can help couples improve their fertility naturally?
Yes, there are a lot. We have supplements, we have dietary aspect of it, and for a man, it's more or less pretty simple, but tricky, because not every person that know. That is why information is what you need. So when you get the right information, you'll be able to see results. So food that is right for the moment can change the body system to make a person. Ordinary food can increase a man's sperm count.
Ooh.
Ordinary food, certain food. That's why we tell the people waiting that eat the fruit in season. The fruit in season does something to the body, something interesting to the body. And for the woman, we tell her, put yourself at peace of mind, right? You need to reassure a woman. Assurance is what a woman needs. So when we reassure, then eat certain food that are good for you for this and that reasons. And, in natural medicine, we don't just deal with the fertility process. We do it during the pregnancy, and then we call it a postnatal care. So after the birth, we still care for the mother to make sure that the mother is fine, the baby is fine. You understand? So there are food and herbs that help us maintain this order. Yes.
Can hear.
Yes. There are food.
Nature
has it all.
Thank you very much. Infertility can be emotionally challenging for many couples. What message of hope would you like to share with those who may be struggling right now?
Okay, for anyone struggling, I know that is very, very frustrating. I haven't come across several persons with this issue. The first thing you need to take off the mind is, hope my partner is not the problem. That's the first issue, and it's psychological. Hope this person is not the problem, or am I not the problem? Even when they've done series of tests, some people still say, I know it might be my body. Many times women take the blame. Yes, and I should mention this, that when it comes to fertility, women tend to be more sensitive and more conscious than the men. Many men, you hardly find them in the hospital or in the clinic for checkup on how fertile they are. But it's the women that are majorly concerned. There are several cases that you can see that after several years of waiting and waiting, they found out that it's the man that is that had low sperm count or something. And these things can be dealt with when couples go through it together. Reassuring each other. If you've tried A or B and it hasn't worked for you, there's something out there that is meant for you and that will definitely work for you. But the first thing is that you should take doubt and self-blame and, seeing your partner with some kind of eyes that, are you sure you're not the problem? Like I mentioned. So with that, people will be able to walk through, those challenging moments. And I pray that family members too will be supportive, because the pressure is most of the time not from the couple themselves, but from environment, society. How is your baby? We're still waiting, you know. Sometimes just let people be and be happy, you understand? So in the midst of joy, in the midst of happiness and acceptance, you can see that before you know it, it's already there.
Yes, so you're going to be, how are you going to advise someone who just went through miscarriage?
Okay. The first thing that is needed to be understood is why the miscarriage. Miscarriage happens for several reasons. A woman can be on her way to her home and miscarriage can happen. But prior to that, what were the thoughts? What was the condition? What did she eat? Because what you put in your mouth is very powerful to everything in your system. And anybody that is why abortion is not so advisable, because any person that has had abortion before, the body creates, we call it antibodies. The body creates an antibodies that attacks what is supposed to survive in the body. So first, if you're young and you're listening to this is going to be very helpful to you, that abstain from abortion. So yes, and for someone that the person needs to understand why it happened. What did I eat? What did I expose myself to stress? Was I mentally drained? Did I think I couldn't carry it? And some people, there's this thing they call something almost like Down syndrome, like the womb is downwards. So for that kind of person, you need to, that's why once you find out that you're pregnant, go see your doctor, because you might be the kind of person that need to be on bed rest for the first 3 months. Some people is close to the end that they had that miscarriage, and you know that one is very, very painful. So you need to understand, follow up with your doctor. Don't take your doctor's appointment lightly. Take it very, very seriously, so that you can know what is best for your body. Some people's body are fragile. That is why they recommend bed rest. And so you need to understand what's happened around you during those moments, what you ate, what you expose yourself to. And in answering these questions, you'll be able to know that next time, these are what to avoid and these are what to stick by.
Thank you very much. How important is education and awareness in breaking the stigma around infertility and encouraging couples to seek natural solutions?
Okay, I think the educational aspect is not, we are working on it. That is why we're here. We're working on it, but I think we're not there yet. We're not there yet. And it would be good if individuals can, realize that we're taken from the ground, and only the things that actually come from that ground can heal and can help us. That is what I would say. Dust you are, and to dust you return. In that meantime, dust will sustain you. That is, I'm saying this because of natural medicine. It is, the awareness is little. But by the time parents, when we go back to our forefathers, when we go back to the very beginning, we see that these are the things that sustained life. These are the things that sustain society. And it is time for us to stop running from what actually works. Even the orthodox drugs are gotten from plants, right? I'll tell people that orthodox drug is just a combination, it's just a means of preservation that brought about the idea of orthodox drug, you understand? It is plants, but certain plants cannot travel to Malaysia for several days on cargo, so they look for a way to preserve it, but sometimes that preservative might not be good for you. That is why we say alternative medicine, right? Natural, what works for you. And in natural medicine, we individual and what works with your body is what we work with. That is why it should be accepted. It should be everywhere. You understand? People should not take it lightly or think it should be the alternative. We should be the major when it comes to, and I think it's the job of parents, grandparents that knows the value of these things to orientate children that go for this. This will work for you, which it will, without any side effects. You know, most of the time, natural medicine comes with zero side effects. And for people out there that think I can't do it, I would rather stick with this. You eat okra. Okra is herbs. You take veggies. You take vegetables. You take all those things are herbs. It's just the name you call it. You know, that is from the mind. It's just the name you call it, and that is what it is.
Thank you very much. Today has been mind-blowing, and I hope I've learned a lot. I hope you too have learned a lot. That natural medicine is the very best for you to tackle infertility, and what we put inside of us is very, very important. Thank you very much. We have come to the end of today's interview, and I want all of our viewers that are struggling with infertility to know that infertility is not the end of the story. There is still hope. With natural medicine, there is still hope. Thank you so much for being with us, and till next time.